Oh, sorry, didn't see you there. Come on in. Hey there, and welcome to the LYYT emergency room. I am the manager here and will be taking you on a tour of our emergency room. What does LYYT stand for? Well, it stands for Liang, Yang, Yang, and Cai. This is Dr. L. This is Dr. P. They are the most experienced doctors and they will be leading us through the tour. In this emergency room, we have different departments, each with their own purpose in our emergency room. These staff are always here to help and do the best they can to make you feel safe. We have a 24/7 staffing schedule, so any patients can come whether it is late at night or early in the morning. In the patrol department, we have 8 security guards. They are always here to look out for you. In the lobby department, we have 11 staffs, which includes front desk receptionists, assistant, and triage nurses, each with different shifts to help assist you in any ways at any time. In our office department, we have me and my assistant manager Heidi, and we are here to provide assistance to our staff and our patients. In our laboratory department, this is where our laboratory technicians run through tests, analysis, and provide information to our doctors regarding a patient's test results. In the surgical department, we have 8 surgeons that are here to help patients that are in critical care or require surgery. In the EMT department, we have 4 EMTs that are here to assist patients that come into the hospital through ambulances. We also have a healthcare department where ER physicians and nurses do diagnostic tests, treatment, and etc. on patients. Lastly, we have the pharmacy department, which is open from 10 a.m. to 2 a.m.
Hi, my name is Dr. Liang, or you can call me Luna, and I'm one of the physicians here at the LYYT. I'll be going over some of our registration/waiting rooms with you. So this waiting room is the one directly connected for the drop-off for private vehicles. Our security guard, it has a station right up at the entrance, and our security guards have access to all of the security cameras throughout our hospital to ensure patient safety. Over here, you can see that this waiting room is actually attached to 2 of our triage rooms, which are private and ensures that patients can get triaged accurately and privately. Behind here is our second registration/waiting room, and this is directly connected to the parking of our emergency vehicles. Now, this waiting room is also connected to 2 of our intensive care/surgery rooms, as well as the rest of the minor surgery rooms, examination room, recovery rooms, etc., and the way to the 2nd floor. These are some of our innovative examination rooms. Our examination rooms are designed to be similar to suites in that they have their own private restrooms, so that these examination rooms in times of utter emergency can be also converted into recovery/stationing rooms.
Let me explain the layout. This layout is very efficient and ensures patient safety and privacy because we have soundproof walls and privacy doors, so patients will be able to freely save their conditions without everyone knowing. We also have a pretty big hallway so patients can freely move around. Wheelchairs are also able to fit in these hallways. All of the rooms can be easily accessed from the hallway.
We also have a recovery room for toddlers or infants, just born infants, and this room can also, in times of emergency, be converted into a neonatal intensive care unit or NICU.
In addition to that, we also have operating rooms that are fully equipped and ready for surgery anytime. We have a room for ultrasounds, a room for MRIs, and a room for full body scans in terms of radiologies, and we have mini labs for testing and diagnosis. We have a delivery room and a recovery room for mothers and newborns, which are very comfortable and post-pregnancy friendly. Last but not least, we have a pharmacy that's open 24/7, readily supplied with medicine, and even a gynecology room for women.
For the safety of our patients and staffs, we have an emergency escape route map that we placed everywhere in the hospital. These maps and routes are important because it can help everyone escape from the hospitals in times of a disaster or emergency.
Along with our specialty rooms, we also have some unique innovations that have largely improved patient experience and our efficiency. The first one is the Burr helmet, which is a helmet with an adjustable icing strap that will help patients cope with pain from injuries or conditions. The helmet is comfortable on the inside but firm enough as a hold to keep the patient's head stabilized in case of dislocation or other injuries. Our other outstanding innovation is our temperature regulating blanket, which constantly displays the patient's temperature while regulating it at a safe level. For example, a patient with hypothermia, the regulation blanket could be an immediate intervention that will help bring patient temperature up. Or a patient who comes in with a fever could use the blanket to regulate and control body temperature.
Yes, these innovations have been really helpful, especially the Burr helmet. Oh hey, my name is Jim Russell. I'm male and I was born on March 4th of 1979. I came to the ER because I had a super severe toothache and a persistent fever. The pain was so bad I had to take 600 milligrams of ibuprofen every 4 hours for it. However, the Burr helmet helped me relieve that pain. What is the Burr helmet? Well, it is this adjustable headwear that I can place on my head, and it comes with an ice pack that I can place anywhere. This greatly helped relieve my toothache, and I was able to wait until further diagnosis.
Based off of the signs and symptoms that Jim Russell is experiencing, notably his swelling around the left lateral incisor, the visible amounts of pus, as well as the fever present, we concluded that the patient is most likely experiencing an infection relating to the root canal surgery he had around a week ago. Our treatment included this. We connected the patient up to IV antibiotics. We cut open and drained his pus, and we gave the patient pain-relieving medications, such as a stronger dosage of ibuprofen, and linked the patient up to IV fluids and continued to monitor his vital signs until the patient stabilized. We've decided to recommend the patient an admission to the hospital to continue monitoring his signs of infection. If this infection persists, the patient should consider undergoing surgery.
Overall, my experience here was very comfortable. I arrived at the lobby and I was registered and triaged. While waiting, I was given the Burr helmet to keep me comfortable. The doctor came after a couple hours and took me to the exam room. One thing I want to mention that I've really appreciated throughout my visit at the LYYT ER is their valet parking. When I arrived, I was in a great deal of pain and everything was kind of hectic. I arrived in my private vehicle and I was able to get in and get registered right away instead of waiting to find parking. That was amazing. Hi, I just woke up. My name is Amber Elizabeth Julian. I'm female and I was born July 14 of 2004. I don't even know what happened. I was just playing in my backyard. And suddenly I was having trouble breathing and also I was feeling really dizzy. When my mommy and my daddy took me to the hospital, I think I even lost consciousness.
For Amber Elizabeth Julian, her signs of low blood pressure, high respiratory rate, mild swelling of the respiratory tract, trouble breathing, bouts of dizziness, and possible loss of consciousness all point towards anaphylaxis shock. We gave the patient oxygen treatment and an epinephrine injection immediately. And then we prescribed the patient with antihistamines, corticosteroids, and linked the patient up to an IV fluid until her condition stabilized. We ordered her an allergy test to prevent this from happening in the future, blood tests, a chest x-ray, and to make sure that her respiratory system is stabilized further. We also ordered her a test on the spirometer. We'll be admitting Amber to the PICU to continue monitoring her conditions, and once her conditions stabilize, we recommend her to be prescribed with an EpiPen that she can carry around in case this happens again in the future.
Well, when I got to the ER, I was rushed to intensive care. The doctors all did really amazing, and they saved my life. Then, the doctors taught us all about allergic reactions, and we went to the pharmacy. The pharmacy was amazing, and they gave us an EpiPen, so that next time when something like this happens again, I can just use the EpiPen.
The most essential part of our ER is our intensive care rooms. They're for patients determined as emergent at their triage who has life-threatening injuries and or conditions that need immediate attention. Our critical care rooms are equipped with all kinds of surgery and treatment, and immediate testing could be done in our testing and lab rooms, ensuring efficiency.
And that's the LYYT emergency room. We aspire to save lives with efficiency and care. Thank you for watching.